Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. First, we'll welcome Dr. Chad Weston of Novant Health, Oceanside Family Medicine and Convenient Care, who will share some back-to-school tips for families. Then we will meet Lani Ellis, a physician assistant who has recently joined Novant Health Oceanside Family Medicine in Bolivia. And finally, Sheila Roberts of the New Hope Clinic will share information on the clinic's 20th anniversary and several upcoming events. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Dr. Chad Weston of Novant Health, Oceanside Family Medicine and Convenient Care. Dr. Weston, we're so glad to have you back on the show again today.
Glad to be back.
Great. And I want to thank you for taking the time out of your busy day, because I know how busy you are, but we do certainly appreciate it. And for our viewers out there who may not have met you last time on the show, remind us a little bit about your education and your background.
Well, my background started in South Carolina, where I went to undergraduate, and then I completed residency training program in Cabarrus Family Medicine, just north of Charlotte. And then I opened a practice there back in 2003, and then decided to get a little bit more coastal, so I've been here since October.
Last year.
Last year, 2017, correct.
Yeah, absolutely. So you joined Oceanside, Novant Health Oceanside Family Medicine and Convenient Care late last year, right? And how's that going for you?
It's going well. It's hard to believe I've been there almost a year.
Yeah, that's great. You know, time flies.
It does.
I used to make fun of my parents and grandparents when they'd say time flies, and I'd think, it's never going to be Christmas. And now that I'm in their shoes, I think, oh.
Well, my teenager told me, we were driving down the road, he was like, Saturdays used to last forever, and now they seem like they go away in a blink of an eye.
Yeah, it happens to all of us. So, well, today I'm hoping we can focus on some back-to-school tips for children and for families. So first, let's talk about wellness visits. So you do offer wellness visits for children at the clinic?
That's correct, and that's one of the reasons why I joined this particular practice is that they wanted to expand the full scope of family medicine, which does include newborns, infants, toddlers, children, teenagers.
Yeah, some of the practices see children maybe like at 2 and up, but you see newborns, is that correct?
Correct. So my youngest patient's a couple days old right now. My oldest patient's about 98, I think.
And so your youngest
full
was
spectrum.
That's cool. Well, getting back to the wellness visits, should you do those annually?
We typically recommend those annually, and that gives us an opportunity to do a couple of things. One is develop some rapport. So as a child grows up and goes through different stages in development, particularly when they get into the teenage years where they may be facing some things that, quite frankly, they're not ready to face. They need some adult guidance when facing those decisions, and so that relationship is started at a very young age so that they have an adult that they can trust and can confide in.
Yeah, that's great. For parents out there who may have children that are going to start kindergarten this year, do you have any tips about immunizations and, give us some guidelines around that?
Well, typically after the age of 4, a child before entering the public school system would be required to have measles, mumps, and rubella, which is in 1 shot, and then an update on the chickenpox shot as well. Those are what are required, and then the flu vaccine is usually recommended, particularly in children who are going to be around other children in a school environment, and that's recommended on an annual basis.
Okay, and you have those immunizations available in your office, correct?
Correct.
For older kids, what kind of immunizations would they require when they're starting to go through puberty or becoming teenagers. What do you get around that time?
Well, and the same thing, annual flu vaccine, because they're around other teenagers who like to share their germs and cough. But then also, we call these the middle school shots, the meningitis shot, and then updating the tetanus and the pertussis. Those are vaccines that we recommend prior to going into middle school particularly. Those traditionally have been vaccines that were recommended upon finishing high school prior to going to college or dormitories. But it's been shown that there's actually some additional benefit immunizing them at an earlier age. There's another vaccine that's optional. It wasn't optional for my boys, though. They all received the hepatitis B, or I'm sorry, the human papillomavirus, the Gardasil vaccine.
Yes.
And that's a series of three shots.
At what age do you give those?
Typically around middle school we start having that conversation, and the idea is that we protect them before they engage in adult decisions and adult behaviors.
Right. I see a lot on TV about those, how important it is to immunize both boys and girls for that. So I think the media is doing a good job of that.
Yeah, I think like anything that is a new recommendation, it does take some time for people to get familiar with what the recommendations are and to get a better understanding of what it is that we're trying to accomplish with that particular immunization.
How about sports physicals? Do you do those?
We do those as well. Those tend to be a little bit more cursory. A pretty quick review of any significant medical problems or any existing medications that they take for things like asthma or any recent injuries like concussion, for example.
Yeah, that's a big thing right now.
It is, and you take those things into consideration, and gives us an opportunity to briefly counsel a high school athlete on, how to take care of themselves and how to participate safely in whatever sport that they choose. So we do offer those. Our office is open 7 days a week. So we offer those through a variety of different channels, including me seeing my own patients as well.
Okay, so they could do them in the convenient care part of it on the weekend?
That's correct.
Well, that would be handy.
I participated in a volunteer sports physical day at the West Brunswick High School here, and we saw quite a few high school and upcoming middle school students, which they don't think that, I'm going to be playing a high school sport, I need to get my sports physical before then, but for fall sports particularly.
Right. Well, you say it's sort of a cursory examination, but hopefully most of those kids are in your office anyway, and so you know them fairly well. And
we can. I mean, there's some kids who may be their only contact with healthcare, and that gives us an opportunity to identify, kids who may have some serious medical problems that haven't been diagnosed previously.
That's a lot of great information, but I wanted to bring up one thing. I heard you're going to participate in the Novant Health Men's Forum. Novant Health's Men's Health Forum.
Men's Health Forum,
that's correct. It's in
correct.
September, Wednesday, September 12th, correct?
Correct.
And you'll be participating in that.
Yeah, I'm going to be part of the panel of physicians in the area.
And it's open to any male in our community, right?
And probably there's significant others too, because that usually who invites the male in for an exam.
That's true. That's true. Well, I understand there's a lot of great physicians that are going to be speaking on all kinds of topics, from prostate and sexual health to general wellness.
Correct.
And have you chosen your topic yet?
Well, my topics are going to be the big three: nutrition, physical exercise, and physical activity, and sleep. And my interest in preventive care really does focus a lot on those particular topics, and coming up with daily strategies and small decision making about how to accomplish bigger goals is really a cornerstone in a lot of people's health. And if they can get control over that, then they don't need as many prescriptions to manage their medical problems.
Yeah. I understand we're even going to be talking about skin care at the event. I believe Dr. Khan is going to be there, and he's going to talk about skin care and ways to look more youthful and feel better. And so I think that's going to be good, and maybe some of the significant others will be interested in that too. And again, that's on Wednesday, September 12th from 3 to 5 at Brunswick Community College Event Center.
Correct.
Right? Yeah, that'll be great. Going back to the children, there was one question I wanted to talk about picking up germs.
Okay.
What advice do you give parents when they send their kids off to school? What's the best advice you can give your parents? I think I know what you're going to say, but... Well,
yeah, wash your hands. That's what I do, and I take a bath in germs every day. You know, I get my annual flu shot. I wouldn't ask somebody else to do it, and I wouldn't do it myself. And I think taking care of the big three. If a kid is very physically active and eating a good balanced diet full of vitamin C and colorful fruits and vegetables, and getting an adequate amount of sleep, your immune system and your body will take care of you. And you'll be able to shake off colds and flus and things like that. And again, an annual flu shot is been shown to help reduce absenteeism in school-aged children, so there's some benefit to not being stuck home with a sick kid, but able to send them to school to make sure they don't miss any important tests.
Yeah, really. Well, I know when babies have to go to daycare and stuff, they pick up all sorts of things. I'm curious, at what age can you give a child a flu shot?
So typically it's 6 months and older.
6 months
is what
and
we
older.
recommend.
Because I know new moms are always afraid when they send their child to school or to daycare or whatever. They start bringing everything home, and then mom gets it and dad gets it and all the siblings, and so it's a real mess.
Well, and it's a hazard of being around other people who, you know, once they come down with an illness, sometimes they don't know that they're sick until they've already had an opportunity to spread it.
Right. So if there's a viewer out there who would like to make an appointment with you, how might they do that?
Just give the office a call. That's probably one of the easier ways to go about that. But we actually have an online function as well, and with some open access scheduling and some alternative ways to do visits.
I love that.
That's probably a more conducive way of making an appointment at 2 o'clock in the morning if you so choose.
Well, and we can put the website and your phone number. We can scroll that across the screen while we're talking, and that would give folks how to contact you. So
perfect.
Thanks so much for being here today. It's been a pleasure. I hope to see you soon.
Will do.
Thanks. Next, let's meet Lani Ellis, physician assistant with Novant Health Oceanside Family Medicine in Bolivia. Welcome, Lani. It's such a pleasure to have you on the show today.
Thanks. It's great to be here. Thank you for having me.
Now, I know you recently just relocated here. Where are you from originally?
Originally, I was born and raised in Florida.
Oh, nice.
And then we spent the last 7 years in Northern Virginia area where I did my schooling and started working as a PA.
Nice. Well, I know that our viewers, as well as I, would love to hear more about your education and your background. Can you share a little bit of that with us?
Sure. So as I said, we went up to the Northern Virginia area. I attended George Washington University in Washington, D.C. for my graduate program. I completed a dual master's program there, both in public health and physician assistant studies. Some of my clinical background, I did 2 years in spine surgery. Primarily seeing patients in the clinic and post-operatively. And then the last year and a half, I was in an urgent care setting with Novant Health in Virginia.
Oh, in Virginia, that's great. That's really great that you're familiar with Novant Health.
Yes.
That makes it so much easier.
Yes.
Yeah. Tell me, do you have any special interests from a medical perspective? Is there a type of patient or that you like to treat?
So I'm really big on patient education. So being a PA is actually a second career for me.
It is?
It is. Prior to that, I was in health education for several years.
Really?
And then my public health studies, those two things combined, I just feel that it's really important to increase health literacy and for patients to really understand not only their diagnoses, but the treatment plan. So just clear education of patients just empowers them to make healthier decisions and just take control and responsibility for their own health.
That's interesting. Sounds like you have a lot of wonderful experience. But what brought you here? Why did you decide to relocate to the beach?
So as I said, I'm from Florida. My husband is as well. In case you didn't know, up in the Northern Virginia area, they get a little bit more snow than here.
Yes.
Although I hear that was a change for you all this year. So we've just wanted to be closer to the ocean and just a little bit slower pace of life in general. And we felt that the Wilmington area was a good fit for our family.
Well, you've come to the right place. This is a great place to live. It's
We're
a great
excited.
place to work, and we love it here. We've been here about 20 years, my husband and I, so we love it very much. Now, I understand that you've joined Novant Health Oceanside Family Medicine in Bolivia. Is that correct?
That's correct.
And that's right next to the hospital.
Yes.
So it's very convenient for you and for your patients. So tell our viewers a little bit about the services that you provide and your partners.
Sure. So I work with Dr. Kenneth Hamby, and there's another PA there, Jason Honecker. We see anything from acute illnesses, same-day sick visits, as well as well-child checks or simply adult and senior care visits. Gynecological routine visits as well, and even doing some just minor procedures such as trigger point injections or things that can be done in the office setting.
We've had both of them on our show in the past, and they were great guests. And that's a wonderful practice. It's just everybody loves it. They have a great staff. It's they're so welcoming when you come into the office. So it's a wonderful place to work.
Yes, I'm excited to be a part of a wonderful team.
I'm sure you are.
Really excited.
Yeah. I'm not sure, do you see patients of all ages?
We see 2 and older.
2 and older, to like grandmas and everybody.
You got it.
Nice. Well, that's kind of nice. I like family medicine because then you kind of get to know what's going on in their home life and what all they might need. And
that's right.
So I believe I heard the other day that you're expanding your hours at the clinic. Is that correct?
That is correct, and that's one of the reasons that I've come on board is to be able to see more patients by the extension of the hours. So we're open from Monday through Friday, 7 a.m. to 7 p.m., and then on Saturdays for same-day visits from 8 a.m. to 2 p.m.
That's really something new in this market, to have Saturday hours, other than the convenient care that's located in Charlotte. But for some of the other practices to be open on Saturday, that's a really new thing. Yeah. And I think in this area that will come in really handy, and you'll have a lot of folks to choose that. With working, they don't want to miss work.
Absolutely.
So that's really great. I'm curious about appointments for the weekends and the evenings. Do you have to have an appointment, or is it walk-in?
You do have to have an appointment,
okay.
But you can schedule not only by phone but also online, accessing the practice through the website. And
I really like that. I like when I can go on a website and choose because you can see all the times that are available, and you pick what's best for you, and that's all there is to it.
That's right.
You don't even have to pick up the phone, so that works out really well.
Yes.
So can you schedule the Saturday hours online as well as the evening hours?
Yes.
Great. That's good. Well, is there anything special that you would like to share with our viewers out there about the practice or about your philosophy?
So I think what's great with this extension of hours is just truly having the family medicine practice as the home area for the patients, and so they're not having to go to an urgent care or even to an ER if the urgent care is very far away, and then all of a sudden their care becomes a little bit disjointed. So it's exciting to be a part of a practice that really wants to keep the patients in their home setting there as the primary care facility, and then only utilize those services really on an as-needed basis if something that's really emergent in the middle of the night, that type of thing.
Absolutely. So if anyone's interested in making an appointment, they can either pick up the phone or they can go to the website. And I believe those are running on our screen as we're talking. So they'll have all that information at hand.
Great.
And it was really a pleasure to meet you. We're so excited to have you in the area. And after you've been here a while, we'd love to have you back and talk about all the new things that are coming and see how the new hours are going. And that would be great.
That would be wonderful. It's been a pleasure being here.
Thank you so much, Lani. It was a pleasure to meet you. Now, let's welcome Sheila Roberts of the New Hope Clinic. Sheila, it's great to have you back on the show again today.
Thank you so much for having me here, June.
We've got some great stuff to talk about today, and I'm real excited to get started. But before we do, let's talk a little bit about you and your role at New Hope Clinic. So first, let's start with your role.
Okay. I'm the executive director for New Hope Clinic. I started there actually as a volunteer when my husband and I moved here.
Really?
I did. I have to stay busy, and we picked Southport to move to because it's beautiful.
Yeah.
And then I was asked to be the executive director in 2009.
That's awesome. Well, you do a fabulous job. I see lots of good stuff out there.
Thank you. I just try to make sure the clinic has the right resources, the right staffing, that it's running efficiently, and that we're taking care of our community.
Absolutely. Well, you're doing a good job. So let's talk a little bit about New Hope Clinic. Tell me about its mission and it's the history of the clinic.
Sure. New Hope Clinic was founded in 1998. We're an independent 501c3 nonprofit organization. Our mission is to provide quality medical, dental, and pharmacy services to low-income, uninsured adults who are residents of Brunswick County who need that care, and we try to provide it in a patient-centered setting.
Well, it's a really nice facility. It's welcoming, it's clean, it's beautiful. It's a great service for the folks in Brunswick County.
Well, it's grown a lot over the years. We started in a small classroom, and now we have 2 locations. We have our main clinic in Boiling Spring Lakes, and then we have a satellite clinic in Charlotte, co-located with Brunswick Family Assistance.
And that's a great place to have it because a lot of your patients probably have dealings with the spot next door. So really, and in Boiling Springs, you're right next to the food pantry.
That's right. We have to work together.
What a wonderful combination there. So I understand that this is the clinic's 20th anniversary. Is that correct?
That's right. Can you believe that?
No. 20 years. Man. Well, that's awesome. And I hear that you have a special event planned to celebrate those 20 years. Is that correct?
Right. We want to give recognition to all the work that's been done for the clinic. Obviously, we still have a lot more work to do, but we're going to have a celebration gala this October, on Friday, October 19th. It'll be at the Stone Chimney Place in Supply. The event will be from 7 to 10. We have live music, some great food, and hopefully some dancing.
Hopefully some dancing. And who's the band?
It's the Duke Ladd Band.
Oh, everybody loves them.
Absolutely. And the food will be by the Purple Onion.
By Art Catering, and they do such a great job.
They do.
Their food is amazing.
So we'll have a lot of our volunteers there, and we want to make sure the community is aware of how much work they do and what we're going to look forward to for serving our community in the future.
That sounds wonderful. I think that you also have another annual event that comes up around that time. It's probably before the gala. It's called Go Jump in the Lake.
Yeah, are you ready to go jump in the lake with me?
No.
Yes.
Tell me about that.
Sure. Several years ago, the Southport Rotary Club asked to partner with us to co-host the Go Jump in the Lake. It's a 10K, 5K, and a 1.5-mile fun run at Spring Lake Park in Boiling Spring Lakes. It's on the first Saturday of September, which is September.
Like Labor Day weekend.
Yep, the Saturday of Labor Day weekend. It starts at 8:30 in the morning, and it's a family-friendly event. It's competitive as well. So.
Oh, is it?
It is.
So it's timed and everything?
We do chip-timed races for the 10K and the 5K. And then the 1.5 mile is something that hopefully we can get a lot of people out there to do, to get off the couch and move a little bit more. And then there's a special at the end of it. Even if you're not a fast runner, you might be able to win an award if you jump in the lake.
Which lake is it?
Spring Lake.
Spring Lake.
There's a park there, and the finish line is right on the edge of the lake. So we give it a prize for the best splash for an adult and for a child.
That's funny. Where does the race begin?
It begins and ends at the Spring Lake Park for all of the different races.
And is it a road race?
It is. It goes on the road, so it's a foot race. We're looking for sponsors for that as well. And registration is open.
Okay. Well, that sounds great. Now, proceeds from both of those benefits, or both of those events will benefit the New Hope Clinic, correct?
Yes. Yep, that'll support our patient care for the New Hope Clinic.
And talking about patients, tell me a little bit about the types of patients that primarily are served by the New Hope Clinic.
Sure. The patients who come there qualify first. They must be residents of Brunswick County and over age 18, have no health insurance, no Medicare, no Medicaid, and no full VA medical. They may be the working poor, working a few jobs, trying to care for their family. It could be someone who's unemployed. So we do have an income limit. If someone comes in and they want to try to apply for our services and they don't qualify, we try to get them connected to another program. There's still a lot of people in our community who can't afford a doctor's office or afford health insurance, yet don't qualify for another program. So we try to help fill that gap so people have always an option to get access to health care, even if they don't have that money to pay for it at the time, so they don't end up in the emergency room or with a disability.
So is there any payment required once they qualify?
No, all of our services at the clinic are free. We have a lot of partners in the community who help us see patients, so those are not always totally free, but we try to work out a relationship with them so they can get additional testing or specialty care that's needed. But what we're mainly doing is primary health care.
Primary health
So
care.
patients who have diabetes or hypertension, you can't go without those medications and regular management. We also have some patients who need periodic care, someone who might just get sick, but we want to get them set up with us as a clinic. We do have a pharmacy on site as well.
Let's talk a little bit about that pharmacy. How does that work?
Sure, it's volunteer pharmacists. We're open limited hours. We can fill prescriptions written by our doctors there to help our doctors actually manage those diseases. We also have a dental clinic on site.
Yeah.
So that's, again, another volunteer program. It's primarily to help patients with an urgent need get a tooth extracted. If it's to that point, we'll never pull a tooth unless we need to, though.
Right.
And then we have a small restorative program for the patients coming through for primary care, and we can do some cleanings as well.
Well, speaking of your services, who are the doctors and providers? How does that work? They volunteer their time and through different specialties, or how does that happen?
Well, we have a small paid staff. They're wonderful. They're so caring. And then we have a team of over 150 volunteers.
Wow.
They're doctors providing primary care or specialty care on site, and some at their offices on a pro bono basis.
I see.
We've got dentists, the pharmacists, nurses. We have receptionists, people coming in to scan records. We use a volunteer for just about everything. And we can always use more. All of our doctors are fully licensed. We're providing quality, real health care. It's just in a different type of setting where it's free for those qualified patients.
What a great service.
We try.
What a great service to the community and a great organization to support. I'm so happy that you've got these events coming up. So if some community members out there are interested in participating in either Go Jump in the Lake or the 20th anniversary celebration, how might they do that?
There are links to all of that information through our website on the events page or through Facebook, or they're welcome to call the clinic.
Okay. And what is your website at the clinic?
NewHopeClinicFree.org.
NewHopeClinic.free. No, NewHopeClinicFree.org.
That's right.
Is that right? And we'll run that on the screen as we're talking too. So how about volunteers? Are you always looking for volunteers at New Hope Clinic?
We are. The easiest way to get started is, again, if you can go to our website, there's a How to Help section.
Really?
And there's a volunteer application right there. So we'll talk to each volunteer about what they're interested in, what their availability is, and make sure it's a good fit, and bring them right in.
So you don't have to be a healthcare provider to volunteer. You can, because there's office jobs to be done and all sorts of things, right?
Right.
So anybody who's interested in learning more about the clinic or participating or volunteering, they can always just call the clinic. Is that correct?
That's right.
Great. Well, finally, if we have viewers who are in need of services, can you remind us of your location and your hours?
Sure. Our main clinic location is at 201 West Boiling Spring Road. That's in Boiling Spring Lakes. And we have a satellite clinic in the Big Lots Shopping Center in Charlotte on Main Street. We encourage people to call first, so that they can find out what they would need to bring, or they can send in their paperwork to apply for the clinic.
And then once if they're approved, and they meet all the criteria, then they would be scheduled for an appointment.
That's right. We do most of our care by appointment, so that when someone's trying to work or care for their family, they can still come in and see and go home. The clinic in Boiling Spring Lakes is open Monday through Friday, 8 to 5, and then this clinic in Charlotte is open limited hours.
Great.
Based on our volunteer staffing.
Well, thanks so much for joining us today. What a great organization, and I'm happy that you were here to be able to spread the word about your events coming up.
Thank you again for the opportunity, Jim.
You're quite welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.